So first to start out with is that over 20 years ago, many women were taking hormone replacement for symptomatics for symptoms of postmenopause and perimenopause, and they were all, or a lot of them were taken off of it due to a study called the Women's Health Initiative study that was done in early 2000s. Prempro was the main medication that was used at the time. Prempro is made with Premarin and Provera. A lot of the women were using that, as well as, this wasn't in the studies, but when we do IVF, when patients have IVF or in vitro fertilization, they're also given a lot of hormones. And those are considered synthetic hormones, meaning that they are not the same molecular structure as the human hormones, which we'll talk about in a minute. But Prempro and Premarin were the two hormones used in the Women's Health Initiative study, which was done in early 2000. When the results came back and looking at those patients, they found that the estrogen and Provera, which is also called a progestin, but estrogen and Provera were in what makes up Prempro. They saw that there was increased risk of breast cancer, and that caused a lot of concern for women. And doctors were taking the patients off the medication. They're also taking it off because they saw that there was an increased risk. There was not a decreased risk of cardiovascular disease, which they thought that Prempro caused a decreased risk in cardiovascular disease, but that's for another discussion. So when there was an increased risk of breast cancer, what was the increased risk of breast cancer? Out of 10,000 women, there were 8 more out of 10,000 annually that would get breast cancer. So although it wasn't a very large increase, there was 8 out of 10,000 that annually would get breast cancer at an increased risk. I normally tell my patients it's like putting 10,000 people into an arena, and in a given year there'll be 8 more out of 10,000 that would get breast cancer if they were taking Prempro. We don't use Prempro now, but anyways, that's something that was that the risk was 8 out of 10,000. What does that mean, lifetime risk? Well, if your lifetime risk for breast cancer is, say, 2%, it would increase your lifetime risk by 0.5%. So you would have a 0.5% increase over your lifetime if you took Premarin and Provera and you were on it for more than 7 years, and you were generally age over 60. And so women age over 60 on Prempro taken over 7 years had these increased risk. Now, these aren't extremely large increased risk, as you can see, 0.5% lifetime increase, or 8 out of 10,000 annually. However, it's brought a lot of scare to patients, and a lot of patients went off of Prempro. Now, estrogen alone, actually, in that study, and again, it was not human identical estrogen. It was Premarin, which is a synthetic form of estrogen that the company used to make the hormone replacement. It mirrored, or was the exact same identical structure as horse estrogen, estrogens that are seen in horses. Now, that estrogen, called Premarin, when taken alone in this study of the Y study, showed no increased risk of breast cancer. So estrogen alone showed no increased risk in breast cancer in this large study called the Women's Health Initiative study back in the early 2000s. Why would some women then take estrogen and Provera, which is called Prempro? They would take that because they had a uterus and they had to take the Provera part, progestin, so postmenopausally they would not develop any uterine lining thickening or any periods again. Those women that didn't have a uterus were given estrogen alone, and the estrogen alone showed, again, no increased risk to breast cancer. So in conclusion, the Women's Health Initiative study showed only increased risk of breast cancer, although very small, as mentioned here, when women were taking estrogen plus Provera, which is a progestin, it showed the increased risk. Well, things have changed. We now use bioidentical hormone replacement, which is a plant-based hormone replacement. I have not used Prim Pro in many years. Some people call it bioidentical hormone replacement. I think a better name is human identical hormones. Human identical, because the hormones that are used come from plants. They don't come from horses or synthetically from a lab like like Provera, but they do come from plants, and from plants it is the exact same molecular structure, hormonally molecular structure of what is made in women's ovaries, or if they're having decreased ovarian production, and they're feeling the symptoms, which is generally in perimenopause, menopause time period, or sometimes even earlier, ages 40 through 50 and above. The hormones that were made in the ovaries, this exact same molecular structure can be found in the plants, and that's why we use bioidentical hormone replacement, plant-based, and I also call it human identical hormone. Now, the question is we already learned that progesterone was Provera, which is a progestin, synthetically made, was the one that caused the increased risk, although small, in the Women's Health Initiative study. If you look at the largest study, what's called the French EPIC study, that looked at the patients that were using Provera and those using progesterone being plant-based, natural hormone or human identical hormone, what did we see? In this French-based study called the EPIC study, Provera actually increased the risk. Well, we already knew that. Provera slightly increased the risk, and the increased risk that they saw was exactly almost the same as the increased risk in the Women's Health Initiative study. But what did they find out with progesterone? Progesterone alone actually decreased the risk of breast cancer. So progesterone in the French EPIC study had actually a decreased risk of progesterone. Now, what was the difference between the EPIC study and the Women's Health Initiative study? The EPIC study was a cohort study, meaning that the study looked retrospectively. It didn't look prospectively. And prospective studies, large-based studies, are hard to find when you're dealing with natural hormones because there aren't a lot of drug companies, or there aren't really any drug companies that make a lot of profit on the natural progesterone. Thus, there aren't a lot of studies that go into it. But a cohort study, and what they do is they look back at patients that were taking Provera and taking progesterone, and then they look from those patients that were taking progesterone and Provera, they saw how many of those patients did develop breast cancer, and they saw that there was an increased risk of breast cancer in women that had a previous history of taking Provera, and there was a decreased risk of those women that were taking breast cancer, those taking progesterone.